How to unlock the sciatic nerve? Look at these two amazing shapes. The sciatic nerve has its origin in the lumbar spine and extends through the buttocks to the same toes. That is why the pain associated with nerve oppression is especially acute and troublesome. This condition usually affects the elderly and pregnant women. In general, the term sciatic nerve interference/deterioration is characterized by a loss of elasticity and flexibility in the back of the leg muscles. It is often associated with the process of muscle contraction, related to age, which usually begins after 30-35 years. Traditional therapy consists of diagnosis and treatment with analgesics. But analgesics alone do not always solve the problem. The ideal solution is to supplement the treatment with a series of simple stretching exercises. Relief is surprisingly quick and effective. Exercises to unlock the sciatic nerve. These stretching exercises are often very helpful when it comes to decreasing inflammation and relieving pain. Of course, the procedure will take some time, because these exercises should be performed slowly, so that the tension gradually decreases. 1. Lie on a flat surface, bend your sore leg, and slowly lift it to your shoulder. When you feel the tension, try to keep your foot in that position for 30 seconds. Then stretch the leg, lie down a little bit, and repeat this operation 2 more times. 2. In a lying position, again bend your knees and bring them gently to the chest, keeping the pelvis on the floor. With the legs crossed, as shown in the figure, take the healthy leg with both hands and pull it. Hold for 30 seconds, then release to its original position. Repeat this step 2 more times. Remember that movement is the most effective way to treat sciatica, however paradoxical it may seem. Stimulating the blood circulation, at the same time, you diminish the muscular tension and you accelerate your recovery.